Hello, my name is Henry Gibson. I'm going to talk about what our platform offers in terms of remote population health management. So remote patient monitoring has been around for a while, but it's been very clearly shown that one simple system for one particular patient group doesn't cut it. You cannot have a number of different apps for the same patients, so you need to be able to combine and scale up, and this calls for an enterprise platform. Now, my background is healthcare IT. I've been working on infrastructure and platforms on a national level in Denmark for many years, starting with the National Health Portal back in 2003 and also several other infrastructural components in the national health environment in Denmark. So I pretty much know what I'm talking about here. Once I started with remote monitoring in 2013, I quickly found out that you need to go from remote patient monitoring to population monitoring, because if you can't manage populations with all the complexities, then you're really in a big problem. So I'm going to talk about that, but before we dive into that, we'll just very briefly tell you about the achievements we have. We had been in production for 6 years, and some of the results we have from clinical trials and from published papers is documentation that we can actually save 35% of the healthcare cost for heart failure patients here in Denmark. And that translates to 15 euros per day. And of course, because the healthcare systems are different across countries, we cannot replicate that exact saving to other countries, but we can replicate the efficiency and the saving of using telehealth in other countries. So let's establish the fact that the platform works. It's been documented several times over by academic parties and published articles and what have you not. So we know it works, so we can talk about how we do this. We have another client that evaluated our platform not because of the costing, but because of the agility of the system to be able to change with the patients as they develop. This is the primary reason we were selected for that particular client, because if you don't have the agility to change over time with the patient, then you cannot manage the problems. What we do is actually we take away the one-on-one scenario and put in a one-to-many scenario instead. This is what we want to do with telehealth. We want to have one clinician able to monitor multiple patients within a very short time. So the current ratio we are working with is around 1 nurse to 60 patients per hour, which give you a ballpark capacity of around 200 nurses for 100,000 patients, more or less. In order to do that, there needs to be a lot of work done below the surface, under the hood, so to speak. We need to work with automation and deployment and availability and all kinds of standardizations to make that work in a production environment, on and on and on. And we currently have a service level availability of more than 99.9%. So we have that covered as well. And this is the advantage of being around for a couple of years. We know our stuff. So what we actually do is we put out a portal for the doctor and the nurses to be able to monitor patients. And we have an app for the patients to submit data through that app. So the purpose of this system is to get the data from the patients, evaluate the data, and tell the doctor and the nurses if intervention is needed or not. And that is basically all we do. We are very good at it, but that's all we do. So the portal requires an internet connection. It doesn't require anything more than that. So it's very simple. The app, of course, requires also an internet connection and a smartphone, but can also be used on the web. And this allows the patient to get data from Bluetooth devices, enter it manually, answer questions, and submit the data to the system that will evaluate if you need to have an intervention or not. So the core of the system is, the middle part here is the pathway configurator. Now the pathway configurator is the doctor's way of deciding what kind of answers I want to see and what kind of measurements I want to see. And depending on the questions and the answers, you can do different things. Depending on the threshold triggered by the measurements, you can do different things. And this is combined into an actionable data that decides the intervention is done or not. So looking at the protocol configurator, this is a very advanced piece of software that allows the doctor to exactly design the interaction with the patient. So he asks the patients, how do you feel? And the patient feels worse than yesterday. In this case, as you can see, we will branch out and do some symptoms acquisition and have the patient writing something for us. But we could also have been doing a measurement instead. And then we progress to weight measurement. And if the weight triggers the threshold, then we go out and do a blood pressure. And if not, then we go out and do a glucose test. So it is actually a branchable logic programming environment that gives the doctor and the nurses detailed tools to work with in terms of getting the right data from the patient. So the important part here is to take note that a doctor with different specialties can actually create the pathway for that particular patient group as they see fit to their purpose, independently of the other doctors. And we can have all of them in our system. So what happens is that when you create a patient pathway, you create the interaction with the patients. And this is pushed out to the patient group And when the patient enrolls in that patient group, they get that questionnaire, they get that pathway, and that pathway defines the way the app works. So different patient groups, different pathways, different apps. At least that's how it is perceived by the patient. But the matter of the fact is that the app is the same. It is just perceived as a different app because of the configuration. So the configuration is done by the clinicians, assigned to the patient group, pushed out to the patients, and then you have a number of different patient groups that can manage their health on the same app with the same system just by changing the actual configuration in the background. So looking at the overall picture here and the enterprise level platform that we have built here, because that's what it is enterprise telehealth, we allow an organization to have an unlimited number of patient groups, with each of their pathways and questionnaires per patient group that are pertinent to that disease and that condition, that allow each patient group to monitor and survey and react to data from that patient group. And all of this is by configuration in the system. So all of these patient groups will work independently and bilaterally well without having the same configuration done. So the configurations differ across the patient group, but the point is that the app is the same. So it's one deployed app for everybody. And the platform is the same, which is the only one platform that needs to be taught to nurses and doctors, so they don't have to learn a lot of different systems. And the basic conclusion here is that one platform with one app allows you to have implementation of a number of different patient groups and a number of different diseases within the same platform. So you don't need multiple apps. You need one platform that can contain all of it, and then you can create the questionnaire and the pathway for each particular patient group that you want to add. So you can keep adding patient groups without re-implementing, re-engaging, redeveloping anything except the clinical pathway that is done by the nurse and the doctors. And this kind of flexibility allows an organization to go out and use what we term as the Linux of telehealth to build out enterprise-level telehealth capacities in huge organizations with huge populations without having a lot of troubles, with a lot of bottlenecks with development and training, education, and many IT systems, but consolidating it in one platform that gives easy reach and easy implementation. If it is not easy to implement and use, it is not going to go anywhere. So we have taken pains to hide complexity and implement things that seem simple and work simple, both for the patient and for the doctor and the nurses. And we have documentation that it works. We even have documentation that it actually increases the life quality of the patients and that it is easy to use. So we don't have any opt-outs of the systems and the systems we have done, not even in the clinical trials. So the basic platform is, of course, as an enterprise level platform, it has integration to medical records, easy. And we have RESTful API, so we can make any kind of integration with any kind of medical record. And on the other side, we have open interfaces as well towards the apps. So if you have existing apps, you can bring data from those into the system. And we will even give you the app as a source code if you want to create your own app or take control of the app because you want it to look and feel differently. We will allow you to get the source code for the app because it's open sourced. It's not important for us. It's important for us that our clients and partners get the right app. So if need be, we will give the source code to them and help them build out their particular app in the way they want it, while still taking advantage of the huge rich functionality in the backend. And the backend supports up to 45 different measurement types, which means that you can have glucose, you can have blood pressure, CGG, ECG, sleep apnea, spirometry, respiratory rate, sit-to-stand test, peak flow, any kind of imaginable value that can be added into a patient group's monitoring regime is actually already there. It's already supported. We don't have to change anything. You can take it in, model out, and start monitoring a lot of different patient groups right away. So all of this together gives you an ability to get on board and get started, implement, and push this out with a qualified, functional, remote patient monitoring or population health monitoring platform within a month or two, depending on how ready your organization actually is to do this. Because as you know, it's all about organization and less about technology. And since we have the technology covered, we can focus on empowering you to do this, transferring all our skills and knowledge to you and helping you build that out and set it up and make it work. So in order to go there, we of course need to be able to help you with setting up a turnkey telehealth solution, and we will do that. So if there's anything that you need help with, like setting up the call center, we know how to do that. Getting the devices in place, we know how to do that. So we have a turnkey telehealth platform for remote patient monitoring and population health monitoring, and we look forward to speaking with you about it. Thank you.